Okay, I'd like to welcome the Farmville and area community, all of you who have joined in tonight. This is important information. The virtual vaccine town hall will help, we hope, answer some questions for people and give you an opportunity to listen to experts talk about the vaccine and also talk about the distribution of the vaccine. We have now passed the 100 million mark worldwide in cases of COVID. And the United States has far more COVID cases and deaths than any other country. We have 20% of the total worldwide. So this distinguished panel that you see here, and I hope you agree that they're a really good looking panel. I think they're going to help provide you with some information. They represent the federal, they have state experience, and they also are local healthcare leaders and civic leaders who will share information about the delivery of the vaccines to our community. Tonight we're going to get started. I would like to introduce Julie Flores. She's the chaplain manager at Centra Southside Community Hospital. Julie has a BA in psychology and religion from Mars Hill College. She has her master's of divinity from Southern Baptist Theological Seminary, and she's the board certified chaplain with the Association of Professional Chaplains with 23 years experience in the healthcare setting. She will have our invocation this evening.
Pray with me. O holy God, we come before you this evening, reflecting on where we have been and how far we've come just to be able to host a program such as this one. We thank you for the tireless efforts of scientists, trial volunteers, the medical community, biotech companies, and government agencies that have worked together to produce and distribute a vaccine to restore not only health and wholeness to our community, but also ignite in us a sense of hope that had become obscured by heaviness. We welcome physical protection for our bodies, which also brings peaceful healing for our weary hearts. We pray for our communities, rejoicing with the individuals who have already received their vaccines and sharing the anxiety of those still awaiting their opportunity. Help us to be understanding and patient towards each other as we all work through the process. I thank you for this group of panelists and the work that each is doing in the vaccine distribution effort and advocating for the health of our population. Bless this time tonight that the information shared may be educational to our community, and may it reach the persons who need to receive it. Above all, we thank you for sustaining us and guiding us through the past year. We ask for continued strength for the journey still yet ahead. Guide each of us that we might be an instrument of healing on this earth. In your holy name we pray. Amen.
Amen.
Okay, I hit the wrong button. I apologize for that. We are so thankful for each of our panelists tonight. They will be introduced as we go through them. I am honored to be able to introduce our moderator tonight. Cam Patterson is the executive director at the Robert Russa Moton Museum. He has a BA and a master's in counseling education from Longwood University. He's a member of the Virginia African American Advisory Board. He's a board member of Centra Southside Community Hospital, He's on the state board of directors for the Virginia Center for Inclusive Communities, and he's a board member for the Virginia Children's Book Festival and the Virginia JCs. Please welcome Cam.
Thank you, Patsy. It's an honor to join you all this evening to be the moderator for this event. My goal is to ensure that this event moves along, to provide space to facilitate the Q&A portion, but really to let our panelists shine as they are the experts as it relates to this topic. A year into the pandemic, this virus is still raging across the nation and across the world. And this town hall tonight was designed as an opportunity to inform our community about the harsh effects that this pandemic has had on our lives and livelihood, in addition to addressing questions and concerns about the vaccine, particularly as it relates to underrepresented and underserved populations within our community. COVID is real. It is devastating. The much needed discussion tonight will hopefully offer hope and practical steps as we continue to move forward. And so as we begin, I want to first welcome my friend and a leader within our community, Mr. Tykin Cooper. He is a community advocate and passionate about the intersection of education, politics, social justice, and sports. He is a lifelong resident of Prince Edward County and executive director of the nonprofit Virginia Excels. Welcome, Tykin.
Thank you, Cam. And tonight I have the pleasure of introducing you all, for those who don't know, to Dr. Cameron Webb, who I've known Dr. Webb probably 15 to 16 years. He used to pop in my home church quite a bit. He was dating the preacher's daughter. And over the past 2 years, we really developed a friendship. He was always this guy, you know, anytime you date a preacher's daughter, it's always a lot of questions. And I think he was questioned quite a bit at church. So I never really built a relationship with him back then, but super impressive guy, a law degree. He's a medical doctor as well, former Obama White House fellow. He was a Democratic nominee for Congress in the 2020 election. And most recently, the Biden administration has selected him to be a senior policy advisor for COVID-19 with a special emphasis on equity. So really thankful that he's here to lend some of his expertise and give us a few minutes tonight to tell us about kind of what's happening from the federal level around COVID response. Cam?
Absolutely. Well, thanks so much, Tykin, for outing me as a guy who scooped up a PK. But it's great to be with you all this evening. You know, as Tykin mentioned, I'm a physician and lawyer. Usually my role is at the University of Virginia as the Director of Health Policy and Equity, but with Inauguration Day came a new job for me, and I'm working on the COVID response team in the Biden administration, helping to lead our response, you know, our approach to getting through this pandemic. And I heard in the introduction that we're, you know, just over a year into this, as Cam, the other Cam, mentioned when he was just remarking. And, you know, I think it's so interesting because in that year, a lot has happened. And so I don't want to spend my time talking necessarily about how the last administration approached the pandemic, but suffice it to say, we're well over 400,000 Americans who've passed away at this point. And we know that we still have significant levels of disease all over the country. And so really the task that we have now is to get this pandemic under control. And we have to do that through a couple of ways. You know, one, we certainly have to make sure that all Americans have access to the testing that they need. Without access to testing, there's really no way for us to know how widespread the pandemic is. We have to make sure that all Americans have access to the vaccine. And that's a huge part of the conversation. That's a big part of how I spend my days, is making sure the vaccine is widely available and accessible. And I know here in Virginia, that's been a challenge to some extent, making sure that folks have access to the vaccine. And so we want to make sure that that's the case. You know, I work on equity, so a lot of that is making sure that all communities within all of our states have access to the vaccine. We're going to do that through a lot of different mechanisms, including kind of community vaccination clinics and mobile vaccination sites, and partnering with chain and independent pharmacies, and working with federally qualified health centers. There are a lot of mechanisms we can use to make sure that we're getting the vaccine everywhere it needs to go. You know, President Biden set a really, at the time, seemed like an audacious goal of 100 million shots in 100 days. And suddenly a lot of folks are saying, is that enough, right? And it seemed like such a big goal at first, but now we recognize that not only is it a big goal, but it's necessary that we not only hit that mark, but hopefully go a little farther and make sure we get more Americans vaccinated. The president this week stated that he wants to be able to get all adults, 300 million adults vaccinated, hopefully by the end of the summer. And that's a big target, but our team is trying to step up to make sure that we can do just that. And that's going to take not just saying, hey, whoever wants a shot, come and get it. It's going to take us also making sure that we engage with communities all over places like, Southside, all over places like Prince Edward, all over places across, the Commonwealth and of course the country, to make sure that we're able to answer the questions people have about these vaccines. I do a lot of these talks, and I still do, mostly because there are a lot of questions that are out there about the vaccine and how it works. And I'll tell you, I've been in meetings every day with Dr. Fauci, with Rochelle Walensky, who's our CDC director, with so many different folks who are experts on the infectious disease side of this. And we have to move quickly to get this virus under control, and the vaccine is a big part of that. Of course, school reopenings are a big thrust, and certainly we want to make sure that we get our kids back in school. Dr. Walensky just last night was saying that, we want to make sure that that's one of the first things that we open up, is getting our kids back in school. And that has to be one of the last things that we close. So that's going to be a priority for sure, but we have to make sure we can do so safely. And that's been the challenge for a lot of school districts, not having the resources to do that safely. So as you can imagine, we got our work cut out for us, but I think we've got a really thoughtful team. And more than anything, it's not the people who are in the building, it's the way that we're connecting with the communities we're aiming to serve, talking every single day with stakeholders from all over the country, and making sure that we're doing the work on your behalf. So with that, I'm going to end my remarks there. There's plenty more to say about COVID. You could take hours talking about the federal response, but I look forward to the questions a little bit later.
Thank you. Julie?
I'd like to introduce Tom Angelo. He's the CEO of Central Southside Community Hospital and a vice president for Central Health. He also serves as the VP of the Oncology Services line for Central Health. Tom obtained his bachelor's degree in radiologic services from the University of South Alabama, and earned his Master's of Business Administration and Master's of Health Administration at the University of Phoenix. So welcome, Tom, and thank you for participating with us tonight.
Thank you, Julie. That's a hard act to follow, but I will do my best. The impact of COVID-19 on our healthcare workers it's been very tough. Our caregivers have been caring for COVID positive patients since last March. In the last 4 to 6 weeks, they've had to care for more patients than ever. They're tired, they're stretched, but their resiliency has been nothing short of amazing. They're an excellent team of caregivers, and their passion to care for patients, it truly drives them. We continue to seek, for ways to support them during these unprecedented times. Many of our community partners and businesses have sent food and gifts to our caregivers. There was also a Heroes Parade that made most every one of our caregivers cry. It was quite a moment. But I want to say thank you from the bottom of my heart for everyone's support, because there's too many to name over this very long and somewhat painful journey. Regarding vaccines, we received our shipment of vaccines on December 23rd and started to vaccinate our caregivers that afternoon. We took care of many people within the 1A group. This was done in coordination with the Virginia Department of Health. We have given the majority of our vaccinations at the hospital and we'll run out of vaccines next week. Until that is, unless the VDH is able to continue to resupply us. We do believe that they will be able to do some resupply both next week and the week after, but we also know that supply is going to become short. The Centris Southside Community Medical Center started to vaccinate their patients that fall into 1B this past Friday. They've vaccinated over 200 patients. They will be doing 250 patients a week. That will be of their patients initially. And they will continue to do that as long as vaccine is available. They could do much more than that per week. But right now that's the most vaccine they're able to get a hold of, which is 250 weekly. We are also preparing for what a mass vaccination event could look like in coordination not only with everyone on this panel, but many members within the community, the colleges, the university, county, town, etc. And once we have enough vaccines and they become plentiful, we want to be ready, and we will be ready to pull off an event like that over the weekend or off hours or whatever needs to happen to get shots in arms. That being said, we believe it will be months before we will get enough vaccine to truly do that. So just to really, unfortunately, to set expectations, vaccine, there's a shortage on vaccine, and I know that others will cover that within the panel. We cannot stress enough the importance of vaccinations. We've seen too many people die from this deadly virus. I talk to people in the community. I talk to caregivers who have lost mothers, fathers. And it's not just the people that are elderly or immunocompromised. It's healthy people too that are passing, both here locally and in Lynchburg. And it's just time for us to do the right thing. And the right thing is to vaccinate. The only way we stop this pandemic is through our communities taking the vaccine as it becomes available. Our healthcare system, those throughout Virginia and the nation have been overwhelmed for months due to positivity rates, and will continue to be until we have vaccinated 60 to 70% of our population. Vaccinations also protect children and babies who cannot be vaccinated. And so we can eradicate and mitigate spread through vaccination. I just want to end by saying we are so grateful to our community, and we appreciate being given the time today to update everyone. God bless. Thank you.
Thank you, Tom. Scott?
It's my privilege to introduce Dr. Robert Nash. He's the director of the Piedmont District with the Virginia Department of Health. He has a Bachelor of Arts in Biology and Chemistry from Bloomsbury State College, Doctor of Medicine from Temple University, General Surgery internship at Portsmouth Naval Hospital, Pathology residency at Portsmouth Naval Hospital, General Medical Officer, Norfolk Naval Shipyard. He's board certified 8N anatomical and clinical pathology by the American Board of Pathology. He's a life fellow in the College of American Pathologists. He's been an associate professor in pathology, anatomy, and physiology and laboratory services, Medical Career Institute at ECPI and the Commonwealth Medical College. He's been chief of pathology and laboratory services, staff pathologist, director of clinical pathology and laboratory medicine, and blood banks, Great Lakes Naval Hospital, Illinois, Naval Hospital at Camp Lejeune, North Carolina, Locums Comp Health in Greenville and Meadowville, Pennsylvania, Southside Community Hospital in Farmville, and Portsmouth Naval Hospital. Active medical license in the state of Virginia. He served active duty as staff pathologist and director of surgical pathology at Portsmouth Naval Hospital during Desert Storm and Operation Iraqi Freedom. He's also been Deputy Regional Medical Examiner for the Commonwealth from 2009 2014. He's been a certified team leader or laboratory inspector for the American College of Pathologists. He has extensive experience with immunological histochemistry, molecular tumor markers, and I hope I didn't mess that up, computerized image analysis, and quantitative DNA analysis. He's also a published author on medical topics. And I will now turn it over to you, Dr. Nash.
You're muted, Dr. Nash.
You didn't miss much. Thank you very much. It's an honor to serve on this panel and to serve our community and this district. These are very challenging times for all of us, and we're going to get through this together, as we always have, as we always will. As you know, there's a national shortage of vaccines. The state of Virginia is currently receiving only 110,000 doses a week. Our health district, which is 7 counties, not just Prince Edward, but Cumberland, Buckingham, Amelia, Nottoway, Lunenburg, and Charlotte counties, in addition to our own home county. We get 1,200 doses a week. That's roughly 1% of our population. At that rate, of course, it would take us 2 years to get everybody the first dose. So I'm very optimistic that there will be more vaccines coming. Tom and I have been in long conversations and short conversations as to how we can allocate these vaccines most equitably throughout our county and our district. We initially were challenged in distribution of the vaccine by having 7 nurses for 7 counties. That's not a whole lot of doses in arms in a week. We've extended our scope of distribution by enlisting 27 additional community provider sites throughout the district right now. So counting our health district and our partners, principally from Centra, thank you, Tom. We now have 34 distribution sites in 7 counties. If you divide 1,200 doses by 34 sites, that's not many doses a week. I received an email at 3:30 this afternoon from Richmond asking if we could distribute an extra 500 doses between tomorrow and Sunday in 3 of their selected counties. Prince Edward was not one of them, but there are 3 counties that are more urgently in need of getting their vaccination rates up. And I, of course, said, yes, absolutely, send it on. So that frees up another 500 doses for the entire district for the first half of next week. How have we done so far? To date, we've given 2,180 doses of vaccine. That was just this week. 900 of those were in Prince Edward County. That's roughly 42% of the total doses given in the district. There are 200 individuals who have been fully vaccinated with both doses, primarily thanks to Centra so far. There are 1A group, Virginia Department of Health starts distributing our second doses to our 1As, our primary medical facing personnel. On Wednesday, we have 240 distribute of those. We've sent Centra another 350 for theirs. We have, with Centra's help, administered by far the majority of our 1A population. We have both been vaccinating in our 1B population for 2 weeks now. We're taking a systematic approach at prioritizing according to CDC and VDH guidelines, with marked emphasis on our most vulnerable populations, those over 75, and of course our critical infrastructure. 1B, as you know, has been expanded to folks over 65, and also those aged 16 to 64 with critical medical conditions. We're also prioritizing that age group. Second doses are being distributed to the healthcare districts based on the number of primary doses they've given for the Moderna vaccine 4 weeks prior to that. So we're keeping our fingers crossed and hoping they come in. We find out Monday or Tuesday morning, and sometimes Friday morning, what we get. So it makes the planning for clinics very difficult. The bottleneck of vaccine availability also makes mass vaccination events, although everybody wants them, they can serve a huge portion of the population in need. We just don't have those numbers of vaccines available at this time. What can we expect? We've got 74 some distribution points, which are really pushing, and we're getting out all the vaccine. Our goal right now is to have our shelves completely empty by Friday morning every week. We're going to get every dose we've got into our population. I could go on, but I'll save it for the question and answer. Thank you very much for your attention.
Thank you, Dr. Nash. And I do want to go back and just note that Scott Davis is our town manager for Farmville. And it's important for us to have different individuals introducing our panelists, because all of those individuals are key stakeholders in this vaccination process in our community as we communicate to you, the public. And so now I introduce Doug Stanley, our county administrator for Prince Edward County.
Thank you, Cameron. It's my distinct honor to introduce our next speaker, the Honorable Thomas Jordan Miles III. He's the Vice Chair of the Buckingham County Board of Supervisors, representing District 4. He has a BA in History from Longwood University, is the Director of Nutrition, Transportation, and Medical Transport for Piedmont Senior Resources, and served as interim CEO during the deployment of the Executive Director, during which he expanded several programs and created new ones in response to the COVID crisis. He also has been recently appointed as a member of the Virginia Tobacco Commission, and we look to work with him in the coming years to benefit our community. Jordan.
Thank you, Doug. I appreciate that introduction, and it's really good to be with y'all on this really important information sharing call tonight. We're glad to have everybody who's on Facebook and who's going to be watching us in different venues. And I'm coming from maybe a little bit different hue as to our regional approach in terms of South Side and stressing the importance of getting the vaccine. And I'm going to keep my statements short in that I do feel it's crucial for folks, that's our friends, family, colleagues, and those who we love living in rural Virginia, to seriously consider getting the vaccination. I'm blessed to say that because of my work at Piedmont Senior Resources with Justine Young, who's the CEO, she'll be talking soon, that we've been deemed 1A because of our interaction with older adults. And I've had both shots. I had 2 Pfizer shots, and I'm okay. You know, I haven't grown a third eye or anything like that. I'm doing well, and I feel great. Let me tell you 2 facts about rural Virginia. The first one is that studies have shown that individuals living in rural areas in the United States are significantly less willing to get into to get the vaccine over those in maybe suburban or urban America. 3 in 10, which is around 31% of people in rural areas, say that they'll definitely get the vaccine. So that's 7 out of 10 who are adverse to it right now. But I'll say this, is that a second fact is that rural areas deserve to be as healthy as any other area in the United States, especially, notably here in Virginia where we are. And rural Virginia should have nothing to be afraid of when it comes to getting the vaccine, other than having a sore arm for 2 days. It's that harmless, and it really is, it's proven safe, as Dr. Nash has said. It's proven effective, not only for people my age, but older adults. And it's going to be the thing that gets us out of this dark tunnel. I really do think that. There are a lot of parents who say they want their children to be back in school. They want the school teachers to be back in school. And I think we all agree to that. We also have to all come to the reckoning that what's going to take that to happen is that we get vaccinated, and we do it together as a rural community, no matter whether we're rural, urban, suburban. We can do it, and we're going to do it. And that's what it's going to take for us to get out of this dark hole. And there's a light at the end of the tunnel. It's had a big impact on businesses. 25% of small businesses in the United States have closed. 17% of all restaurants in the United States have closed. The only thing, and the economy has shrunk, there's no doubt about that, but it's going to grow. And the only thing that's going to grow it is if we all get on one accord and trust science and get on the same page and move forward and keep our eye on the ball and become vaccinated. Obviously, do your homework, be smart about it. Don't trust social media, trust what science says. I think that's very important to stress. In rural Virginia, especially South Side, we've seen a lot of great local endeavors. Appomattox County has done business vouchers. Buckingham County, we've given out close to $180,000 in small businesses, and CARES Act. Prince Edward County has done the same thing. Cumberland has done the same thing. So we've got a lot to be proud of. And, small businesses are the backbone of the economy. COVID's hit small businesses. As I said earlier, 25% have closed in the United States, whether you're a farmer, mechanic, a cook, whether you work for the state, work for VDOT, that kind of thing. It's important for all of us to get it, not only because of that, but because of the supply chains that we've seen that have been broken, that have really limited everything that we do. Localities can help and are going to be helping with vaccination efforts in terms of communicating with vaccinatepiedmont.org. You're going to see more of that tonight, and you're going to hear more about that. You're also going to hear more about localities engaging with the Virginia Department of Health centers, such as the one in Lunenburg and the one in Buckingham that we have, and other medical facilities, Centra, their satellite sites, county websites, reverse 911 callbacks, all that kind of thing. And even though you might have had your COVID shot, or shots as I have, I think it's very important to continue to avoid large crowds, because not everybody in our family, not everybody in the community has been as fortunate as we are in terms of getting their COVID shot. So continue to wear your mask, continue to do the right thing. Treat your neighbor as you'd want to be treated. The Bible says that, and that's all the more important than wearing your mask, especially when you're in close proximity to someone or you're in an indoor area. Many have gotten their vaccines. We've seen a lot of that coverage. So they're on third base, but it's going to only be until most everyone that is, gets their vaccine, until we can get across that home plate together. So thank you.
Thank you, Jordan. And our final panelist for this evening, who will share some remarks, is Justine Young, Executive Director of Piedmont Senior Resources, our area agency on aging. Justine received her BA from the University of Florida, a Bachelor's of Science in Nursing from Lynchburg College, along with her MBA. And she has worked to mobilize not only on behalf of her agency, but also in her work, Justine, I believe, with the U.S. Army.
Correct.
As she has helped to mobilize with them as it relates to COVID as well. So thank you, Justine.
Yeah, I've had a unique opportunity to experience the COVID situation at the very beginning because I was mobilized in April last year. And I'll tell you, I just got the call this afternoon to plan to get ready to go again. So kind of been waiting for that call. But Piedmont Senior Resources is very excited about this collaboration and everything that we're doing for the seniors in this area. You all know from the news, everything you've read, seniors are particularly susceptible to the more adverse effects of COVID. They are at the highest risk of death from the virus. And I would say, based on what Jordan said earlier, don't use Facebook as your medical source. We would like for people to call us, call their doctors. We have staff who are out working on helping people understand what the risks are. And a lot of our clients call regularly. So we have a lot of opportunity to engage the seniors in the 7 counties of the Piedmont Health District. PSR has partnered with Centra in order to give the vaccine to the highest risk group here in the community, which is these more frail senior citizens who are actually homebound. And that was a big question. How are they going to get the vaccine when they can't drive and they have great difficulty getting out and getting anywhere, and putting them in a position where they're going to sit with many other people puts them at greater risk. So we were very fortunate that Tom Angelo and Central Health agreed to partner with us. And starting Monday, we will be delivering clients to Centra for the vaccine. Very excited about that. And we've had good luck with the calls that we have made. Our seniors seem to be listening to us. Most of them seem to be willing to go ahead and get the vaccine if they have not had it, and most of them have not. So as far as this area goes, we've had cultural and historical issues here that make people question the vaccine, certainly, and the safety of getting that. But again, we're educating people as much as we can. I hope that as the vaccine is being administered in the community and people know people who've received the vaccine and know they didn't die or go into anaphylactic shock at the time or have any major adverse effects, we hope that will encourage more people to feel comfortable obtaining the vaccine. Our staff are very, very engaged in supporting these seniors. And I think most of the seniors want to talk to a physician to make sure, because of complicating factors with all of their comorbidities, their multiple different medical diagnoses, and they're not sure if it's safe for them individually to get it. So that's the problem that you have when you try to do a mass event with them. They all want to talk to the physician first. And dealing with seniors is a little different because many of our clients have difficulty talking on the phone. So even making that phone call to the physician's office can sometimes be more difficult than they can do. Or if they can make the call, they can't hear perhaps the full conversation on the phone. So there's just a lot of barriers for our seniors. So again, we really appreciate Centra's offer. And we're just really excited about helping people get to those sites. And I would say that if anyone is having difficulty and they are 60 and over, to please call us and let us see what we can do to help them with this process. And thank you so much, Cam, for the introduction.
Thank you, Justine. Great example of the good collaboration that's happening in our community. We've got a lot of good questions trickling in, and I would love to kick off this first question, Dr. Webb, if you are able to give it an answer for us. Someone asks, what's in this vaccine? How do I know it's safe for me? And additionally, they asked, once you take the vaccine, how long does it take for you to gain that immunity? And is it something that you'll have to take continuously?
Great questions. Great questions. So I'll start with kind of the middle question. I'll certainly talk about I'll just start with what's in the vaccine. That's a good place to begin. I always tell people it's really there's a lot of science in there, but it's really only 4 ingredients, so to speak. You'll hear a lot of chatter online and in different places, but a lot of it is misinformation. So there are 4 things that are really in this vaccine. The first is the actual, product. It's the messenger RNA. It's a genetic material, but essentially what it does is it sends a message to your body. It tells your body how to create a protein, and that protein is something that's just a part of the coronavirus. So it's not teaching your body how to make a full coronavirus, just the little spike that's on top of the coronavirus. And what it's doing is it's telling your body, if you see this spike, attack it, right? And so what it's doing is it's not exposing your body to the potential virus, but instead just that spike protein, which we say is highly immunogenic, meaning your body will develop an immune response to it. And so that's a good thing. It teaches your body how to fight that infection before you ever see it. And so that's what's a good thing. That's the messenger RNA. The second ingredient that's in there is what's called lipids. And the thing is, messenger RNA itself breaks down really quickly in the body. And so because of the fact that it breaks down so quickly, it doesn't make it to the cell to do its job, to teach your body how to fight the infection. So those lipids kind of encase the messenger RNA, they surround it, and they allow it to be delivered into the cell. So that's the second ingredient. Third ingredient is a combination of salts, and those salts get the vaccine itself down to the right pH or kind of acid-base balance to make it through, to travel in your body and to get to the cell. So again, that's the third ingredient, also helps with that delivery into the cell. And then the fourth ingredient is some sugars. And those sugars actually work to keep the lipids from sticking together when the vaccine's at colder temperatures. And as you know, with the Pfizer vaccine, it's stored at ultra cold temperatures. And so those are the 4 things that's really in this vaccine. In terms of the science, really the science is power packed into that messenger RNA. And people say, well, how did we develop it so quickly? Well, we've been working on it for about 20 years now. So it's more so that it was technology that had finally gotten to a point where we were ready to use it. And then we had a pandemic where we needed to use it. And then the federal government invested billions of dollars into making sure that this happened. And so it was a matter of being in the right place at the right time with the right technology that was at the right stage of development. And it found the right virus where it could work really well. It was kind of ideal for this virus. So for all those reasons, that's kind of the description of what's in it. There was a question about, when I take the vaccine. Real quickly, I will say, for anybody and everybody, we can talk about some of the side effects, but always talk to your provider, right? Every individual is different. So talk to your doctor, hopefully you have one, or a healthcare professional in your community who can give you some guidance on your own, medical conditions. People who have chronic medical diseases, things like diabetes, things like high blood pressure, things like heart disease, they absolutely should take this vaccine, by and large, because it's going to protect them from having those bad outcomes with COVID. But even still, for folks who have severe allergic reactions to things, that's one of the categories where we say, make sure you talk to a health professional to figure out how to do it safely. So if you have any questions, make sure you direct those to a health professional. There's the question, about, how long until I have immunity from this. And so there are 2 doses for both the Pfizer and Moderna vaccines. Those are the 2 that are approved by the Food and Drug Administration for emergency use authorization. The Pfizer one, you take the 2 doses spaced out by 3 weeks. The Moderna one spaced out by 4 weeks. Just for all intents and purposes, they are the same vaccine. They have the same technology and they have essentially the same effectiveness rate, 94, 95% respectively. So they are absolutely identical. They're a little difference in the dosing regimen, 3 weeks versus 4 weeks, but just keep in mind, don't feel like you got shortchanged if you get one versus the other. I got Pfizer, my parents got Moderna, we're all happy, right? So that's the way that I would think about it. But after the first dose, what we tell people is 10 to 14 days after that first dose, your body will have a little bit of an immune response to it. So your body will have a little bit of protection. That protection, though, isn't what we call durable. So it doesn't last as long as if you get the 2 shots. And so that's why it's really important. And we say maybe around 70%, but it doesn't last that long. If you get the second shot, you actually can get up to 95% efficacy and our expectations that lasts longer. Now, remember, the first people in the world to ever get this vaccine happened this past summer. So we don't have years worth of data for how long it protects you, how long it lasts. What we know is that it works for now. And you may have heard Dr. Fauci over the past few days saying with these variants, these strains, the UK variant, as we call it, or B117, there's the South African variant and the Brazilian variant. We're paying close attention to all of those. They may have some impact on how well the vaccine works. But what we know is that the vaccine seems to still work for all three of those. It doesn't work as well as it does on what we call the wild type or the original, but it's still, there was enough of a buffer that it still offers a lot of protection. And that's what we need. We need our communities to all get vaccinated so we're not spreading any more COVID. There are no more opportunities for it to mutate. And then, you know, we're making sure we're all protected. And so I just said a whole lot of words. I said a whole lot of words really fast, but hopefully that was helpful. Cam, I think I missed one of the questions in there. There was one more part that I didn't get to.
No, you covered it all.
Okay. Love it.
So I appreciate that. Thank you very much.
Mhm.
My next question is for Dr. Nash. The governor had mentioned yesterday as a part of his COVID announcements that there would be a statewide registration system that would be deployed. Could you potentially speak to how it might impact Piedmont Health District?
That is in the works. It is not for prime time yet. I expect that'll be rolled out early next week. That is a registration system through the state to refer individuals who go through that system to their health district. More granularly, as my boss would say, to their local county health department, so they can get access to the health department in their county and get on the register for their vaccine. That's how that is designed to work. We've had some challenges in our district being without an IT expert for about 9 months. Our website is now up and functional. You can register directly on our public-facing web sheet, which has finally been updated after 2 years. Nobody's interested in Zika anymore. We're up and running. We're also linked into the website for this organization, so those seeking registration can go to any of those 3 portals as soon as the state has theirs up and running. We expect that to be very helpful for those with computers. The issue that we discussed this morning at our roundtable staff meeting at the district leadership addresses some of the very common issues. What about our prime candidates in our most vulnerable populations, those over 75, those in our underserved communities? These people don't have computers. My sister's a retired anesthetist. She doesn't have a personal computer and will never get one. We have to find new ways to communicate and reach out to these people. We talked about going through Jordan and his organization, Justine, her people, Cameron, we want to get up with you through the Mountain Center, and Patsy, we want to reach out through the faith-based community and contact every pastor in the entire district, 7 counties worth, ask them for their input. Can you get us a roster of your parishioners who are particularly at risk, comorbid conditions, 65, 75 and older? Are you interested in getting your vaccine? Get us those rosters. We can go analog instead of digital. We still use paper and pen. We get that data, we will get those people on our rosters and get them vaccinated. Did I answer any of your questions, or did I just ramble?
No, I appreciate that. Thank you.
Need your help, Cameron. Thank you, Cameron.
Cam, you're muted.
Sorry. Tom, this is for you. It relates to testing. The question is, where are there COVID testing, specifically PCR tests in our area?
So we're testing as appropriate if people meet the CDC guidelines through the medical center. When they come in the emergency room, we test if under the same criteria. We've been consistent with that from the beginning. And so there's specific criteria that they have to fall under to be tested. We do have a quad test that rules out flu, both strains of flu and also the COVID infection all at once. So we're quickly able to tell whether somebody has the flu or COVID and do the right thing by them and get them the right care right then, right now. So
I appreciate that. And kind of a follow-up to that, a question was posed. Can you offer a bit of explanation between rapid testing and PCR testing?
yeah, so we have tests that we're able to do through our lab in-house that usually can be done with turnaround the same day. We usually do those for people that are critical placements. And so it could be a mental health patient that needs to get to the proper facility, but we have to rule out COVID ahead of time. If it's the other test, we send it to LabCorp, and that can be turned around usually in about 48 hours. There was a time when that went out 7 to 10 days, and so there's been dramatic improvement with that. And so those would be for folks that we'd say, okay, you do not need admitted at this point in time. You do show symptoms of COVID. We're going to go ahead and test you. We're going to ask you to go home and quarantine until you hear back from us, and we'll let you know whether the test was positive or not.
Excellent. Thank you for that. Our next question relates to building awareness in the community. I know there's been some great conversation amongst stakeholders as it relates to finding ways to communicate information to the public. And so I'm just going to throw this out for those who care to answer, and it can be multiple folks that give thought to this, but if you could maybe articulate some of those conversations that are being had and some of the planned efforts that we can look forward to as it relates to putting information out. And Doug, feel free to jump in on that. Scott, too, as well.
Well, I'll just say that all the major stakeholders here are trying to come together and work on messaging for the community. I think that's one of the things, and the reality is none of us were really prepared for what we're facing. And as the doc mentioned, a lot of our websites and other media forms are out of date. We're having to develop new ways to get information out. But we're working with letterpress in the process of getting ready to launch a couple new Facebook we've got as well, but web pages designed specifically to help us get out the information. And Patsy, I don't want to steal your thunder. I know you may want to touch on that a little bit later, but I think we've all come together this week in the last really 48 hours. And I can't thank Ilsa enough for helping guide us through this process. And Dr. Nash, thank you, and David for y'all's input as well. I think we're going to be able to give folks a good resource page to find out what's available in the community, where they can go. And as this develops further, as far as these additional sites where they're going to be able to get vaccinated, we'll be able to push that information out to the public. We're also looking at, as we were saying, the kind of the analog means, whether it's a phone bank or being able to send out traditional mail to some of our folks out there who aren't connected to the internet. We're going to try to look at those resources as well to make sure there's no stone left unturned and no group or segment of our population that we can't get to. And we certainly appreciate all of our partners, especially Justine, your efforts to try to reach out to the seniors in our community. Those, frankly, are the ones we need to be talking to right now. And not only are you talking to them, but you're going to help deliver them to the location. So we appreciate that. Scott, I know you've been working with us. Do you want to add anything as far as, I think it's a good example of town-county cooperation, and we're trying to make sure that we're messaging with one voice.
Yeah, Doug, I agree. I think there's other partners. I mean, we're all a community, and the goal is for all of us to have a partnership in this. And some of the other partners that we can reach individuals, it can, if it's through written means instead of just virtual and the websites that we have, we could send, I think, to parishioners. When we get, Dr. Nash mentioned, sending that information from churches in the counties, if we can push it out in their mailers that they do to their parishioners, because I'm sure that still takes place in many churches. Even through the Moton Museum with UCAM, a lot of people that are members of the Moton into different communities. I think there's a lot of opportunities that we have to push that information out. And also we have partnerships with Hampton-Sydney College and Longwood University that can help in this vaccination process as well.
If I could add very quickly, Cam, you've heard from two fine men, Scott Davis, the town manager of the town of Farmville, and Doug Stanley, the county administrator in Prince Edward County. But let's the folks in Amelia, the folks in Cumberland, the folks in Charlotte, the folks in Buckingham, the folks in Nottoway, the folks in Lunenburg. It's going to take this kind of collaboration and this kind of commitment from local leaders, from local people, business people, the elected officials, but the administrators. This is what it's going to take: the collaboration, the communication, to get all of Southside Virginia vaccinated and reopened and ready to go. It can't just be one county. It can't be an island, or else it won't work. It's got to take the whole Piedmont Health District, Planning District 14. So let's be committed and pull up our bootstraps and be ready to go.
And Jordan, thank you for that. But I'd also like to say that we're already, working towards that with all the counties, because PSR is picking up clients in all 7 counties as long as the supply at the hospital lasts for us to do so. So we are starting with Prince Edward and then Nottoway, but we will be moving through all 7 counties of the Piedmont Health District to pick up those seniors and bring them to Farmville to get those vaccinations at Centra.
Thank you, Paul. Appreciate that. My next question, Dr. Webb, I'm going to come back to you for this question. There was some conversation about individuals who are pregnant, breastfeeding, or considering pregnancy in the future. If you could maybe speak to some of the advice being given in that arena.
Sure. So the official guidance from the American College of Obstetrics and Gynecology is that individuals in all 3 of those categories, whether they are currently pregnant, whether they're breastfeeding, or even women who are thinking about becoming pregnant, should still get vaccinated. First of all, keep in mind the risk of harm from the virus is much more significant than the risk of harm from the vaccine. Secondly, I think the studies, the trials actually, we know that they prove that the vaccine is safe and that it's effective. And so we feel like, from the American College of Obstetrics and Gynecology standpoint, they felt like the safety profile of the vaccine was such that that the benefit was so significant, they didn't want to withhold that from women in those situations and delay their ability to protect themselves from this virus. And as an internist who works on the coronavirus unit at the University of Virginia, I've admitted several women who've had COVID-19 had to come into the hospital at 20 weeks pregnant or 23 weeks pregnant and have been really sick. And I think that that's the one thing that people don't realize. They think that this virus, this pandemic really only causes harm on kind of, much older adults, but really it's anybody and everybody can be at risk. And I think this vaccine is one of our most effective ways to protect people. So it's definitely recommended.
Thank you. This question, Dr. Nash and Tom, if you could offer comment on it. There are folks that are concerned with impending weather. Should there be a need to cancel their vaccination appointments as a result of that? Will their spaces be held? And what will that communication look like?
So I'll go first, Dr. Nash, if that's okay. From where we sit, we would hold the vaccine and schedule them timely being probably within a day at most, to make sure we continue to use the vaccine up. And so that would not be an issue. And to go a step further, if it was a second dose, there is no harm in going out another day or another couple days from the 21-day mark if it's Pfizer, or from the 28-day mark if it's Moderna. And so just so people can rest assured that an extra day, an extra week is not going to make a difference in your ability to have good immunity. Dr. Nash?
I absolutely concur with Tom, and I'll flare out on that after I give you our scheme. If we do have those individuals who have transportation issues, Jordan Justine, thank you for addressing the transportation issue. We brought that up earlier 2 weeks ago. You guys nailed it. Thank you. If we do have individuals who have to cancel their vaccine appointment for one day, they will be right at the head of the list on our very next clinic day, or the very next day that's convenient for them. They'll be at the top of the list. As Tom mentioned, if it's a second dose, as somebody who's worked in blood banking and played with the immune system for 44 years, you can actually delay the second dose by up to 2 weeks. And what we found with infectious disease that requires multiple doses or booster doses of vaccines, when you delay it by a week or so, the effects of that booster dose are even more enhanced than when they're given on time. The on-time dose is optimal. We try to contract it as close as we can to the first one, but still get optimum efficacy. But if you're a week late or even 2 weeks late, it makes it even more potent. So to reinforce what Tom said, don't worry about being a day or two late on that second dose. It only makes it stronger.
Thank you both for that. This next question could potentially be answered with Justine and Dr. Nash. There was a question in relation to those that are caregivers for individuals over the age of 65. Are those individuals able to be vaccinated? And would they fall into that 1A or 1B category as well? You muted, Justine.
You want to go, Justine? Unmute yourself.
Yes. My question would be, are the caregivers themselves age 60 and over? And in that case, we've already had a couple of those questions with the folks we've called, and we have said yes. If the caregiver is 60 and over, we will definitely do it when we're taking that client to get their shot. And I guess I also need to defer to Mr. Angelo and you, Doctor, whether or not if they're under 60, should we bring them as well? And I have no problem doing that if they're the caregiver, in the home with that client.
I absolutely agree. A caregiver is a caregiver. 1A. If you haven't had your shot yet, you're overdue. Come on in.
Okay.
Perfect. You heard it from the source. Thank you both
Cam,
for that.
Can I
Yeah.
add one more thing? I don't know if I made it clear before, but if there's anyone out there who is 60 and over, they may not be a client of PSR, but if they cannot drive and they cannot get to an appointment to get this vaccine, they should call Piedmont Senior Resources.
Dr. Nash, this is a question for you. We have seen some movement in recent days as it relates to vaccinations for Prince Edward County public school educators. What would you say to those educators who are working in the neighboring Piedmont district counties?
I believe we covered a vast majority of Prince Edward County educators today. The leftover folks from that group that haven't been covered today will be covered Tuesday. I'm in close communication with Cumberland County School and Buckingham County, making arrangements to get their staff covered within the next 2 weeks. Same for Amelia. Nottaway is going to be fairly easy. They're in the mix. Dave hasn't had them scheduled yet, but they're very close. We're working with our partners in Lunenburg County and Charlotte County to get all of our public school teachers vaccinated before the end of February at the very latest, if not within the next 3 weeks.
Excellent, thank you. The next question that I have relates, and this will come back to you, Dr. Nash, to contact tracing. If you could just explain for those watching, what does that contact tracing process look like on BDH's end?
Once we have a verified positive test and we've identified that patient, the clinical investigator has already contacted that patient, pretty much gotten a list of contacts from that patient with whom he's had relatively close, possibly suspect, close enough contact with his associates for the previous 4 days prior to his test. That list goes to our contact tracing team. They will then each contact each one of those individuals, notify them that they have been in close contact with a documented diagnosed case, give them the symptoms that they may notice. Have they had any symptoms yet? Who do they live with? Give them living conditions. Are they in? Can they quarantine voluntarily for the recommended 14 days? Go through the whole list of things with them, get them plugged in with the SARS program or the SARA program, excuse me, where they can check into the computer twice a day, enter in if they have any symptoms or not, and follow those people for 2 weeks to make sure they're not contracted the virus or a vector for the virus. Have I explained that process well enough?
You have. Thank you very much.
Yes, sir. You're muted, Cam.
I want to go back to your explanation earlier, Dr. Webb, as to what was in the vaccine. Can you clarify again for some of our viewers why there's the difference between the two vaccines in terms of when you get that second dose? And then if you could also just kind of talk about, how long, if you've had COVID, should you wait before you go get vaccinated?
Sure. So in terms of the two vaccines, they're slightly different. Doses and the regimens are a little bit different. And so in their trials, what they did is there are different phases of trials for vaccine development. And so in the first phase, they're really trying to figure out is this safe? They're also trying to figure out what dose actually works. And that's what, as they move into phase 2, they're trying to figure out what dosing schedule is the most effective. And I'll give you the example of a third vaccine that's not here yet, but it's the Astrazeneca vaccine that's being developed in the UK. And what they found is that when they did a full dose, it was about 62% effective. When they did a half dose, it was 90% effective. They only learned that through the process. And so that's why it's still not approved here yet, but they're just continuing to look a little bit closer at, well, what's the right dosing regimen? So both for Pfizer and for Moderna, there are slight differences in kind of exactly the combination of how they put the vaccine together and exactly what those doses are, how much mRNA, how much materials in each one. But I think that's the reason for the difference in the regimen. It's just based on what they learned from their different studies in terms of what gets the optimal coverage for each of those. But again, they're incredibly similar. It's the same. They both got the same blueprint for what mRNA to use for that spike protein. And again, they're completely similar. The one thing is I wouldn't call them quite interchangeable, right? If you get the first dose of the Pfizer vaccine, you don't go and switch and get the Moderna vaccine for your second one. Whichever course you start with, that's the one that you end with. So that's kind of one of the big thoughts there is just, stick with the one that you have. But in terms of how well they work and how safe they are, pretty similar. So that's the first piece. And Cam, please repeat the second part of the question. The second part was about, how long if you've had COVID. So that's kind of an interesting question. Initially we were saying the immunity that you have from COVID, it probably lasts for some period of time. Once you've had the virus, your body it develops immunity to it. That's how you clear the virus ultimately. And that'll last you for some period of time. But we also know that people began to get reinfected with COVID and usually happened at about 3 months after the first infection. And so some would say, oh, you can wait, 3 months because you'll have some protection and then get vaccinated. The truth of the matter is, once you're no longer sick, you should go ahead and get vaccinated. Once you're feeling better, completely recovered from COVID, it makes sense to get vaccinated because our expectation, our understanding is that these vaccines, it provides a longer duration. So the length of time that you're protected is much longer. We want people to be protected as soon as possible. It's also a little more predictable kind of what kind of response your body's going to make in terms of immune response to it. And so we want to make sure that everybody gets that optimal coverage that we can get out of the vaccine. So once you're no longer sick, once you're feeling okay, I think it's worthwhile to start that conversation with your doctor and say, hey, can I go ahead and get vaccinated? You don't have to wait a full 3 months before you can get vaccinated. Just, certainly not if you're sick, certainly not if you're in the hospital. And that's in general, right? Not even if you're just sick from COVID. If you're sick from the flu or if you're sick from something else that just has your body's defenses down, you want your immune system operating at full tilt, really absolutely operating at its best. And actually, we've seen some studies from other countries that show that binge alcohol use causes a reduction in how well the immune response is launched. So don't drink too much alcohol around the time that you're getting your shots, right? Those are all things that we want your immune system to be in tip-top shape so it does mount a good response and gives you some good protection.
Thank you for that. This is my last specific question, and then I've got a closing general question that I would love as many folks to answer as would like to kind of close us out. But this last specific question, I'm going to send over to you, Tom, and it relates to the cost of the vaccine for those that are taking it. Is there a cost? And folks just being concerned if they don't have access to insurance.
Yeah, so that's one thing that will not happen. No one is going to end up having to pay anything. We have been billing insurance, and then if insurance don't pay, we have been writing it off, and we're committed to doing that for the long haul. We do not want money to be a barrier to getting the vaccine, and it will not be.
Thank you for that. My last question, I hope tonight's panel, for those who have been watching, hopefully provides a glimmer of hope. I know that within our community, there's been a lot of nervousness. Folks are scared. They're frustrated as they await the opportunity to be vaccinated, or if they're considering vaccination. So, I just want to open it up to everyone that would like to answer. What would you say to individuals who are nervous, scared, frustrated as they await or consider vaccination.
I'll
Well, I'm
start.
happy-
Oh, go ahead. I'm sorry.
Oh, well, I was just gonna say happy to go first, even though I think Tom actually beat me to the punch. But what I would say is a couple of things. The reasons for vaccine hesitancy, as we call it, are three. The first is complacency. It's that sense that the virus hasn't caused me any problems in a year, or I know somebody who got the virus and didn't even ever have any symptoms. I'd rather take my chances with that than with this brand new vaccine, right? And I think that idea of complacency, that's one of the dynamics. The next is confidence. People being worried about the safety or the efficacy. And then the third is convenience. Do I have access to this vaccine? Those are the three reasons for vaccine hesitancy. It's 3 C's: complacency, right? Confidence, and convenience. And what I always tell people is, I'm not here to sell anybody a vaccine. What's important is that you get the information that you need and you make the decision that's in your best interest. I tell people why I made the decision to get the vaccine, why my wife made her decision, why both of my parents made their decisions, why my father-in-law made his decision. Those are all pieces that we think are important for people to understand. We all had different reasons, and maybe they'll get to the bottom of their reasons for either wanting to get it or not. But I just want to make sure they have good information to make that decision. And ultimately, as adults, make the best decision for you and for your family. I believe that the vaccine is a really good decision for you personally and also for your community. But again, that's why I'm here doing these kind of sessions. I do one every single night. It's because it's so important to get good information out there to people that they can incorporate and make good decisions with.
Well said, Cameron. You said that really well. I think around the anxiety piece, the one thing to remember is a few things. One is that everybody is going to get vaccinated eventually if they want the vaccine. And so, patience will get us there. The other piece, Jordan talked about masking, social distancing, hand hygiene, and all of those things. So I can tell you, we have an intensivist that daily is inside positive, COVID positive patient rooms daily, and has been since last March, and has never contracted the virus. And it's because he did all those things well. And I can say that for a number of nurses as well. So as long as we protect ourselves, we're going to be okay, and we will get there. And as long as we're patient, the vaccine will be here in mass. Johnson & Johnson is also not very far away from having their vaccine ready. And the good news with that is that will be much more efficient in that it's a 1-dose vaccine. So please be patient, and we understand your frustration.
I'll add a couple more points regarding folks' apprehension and fear. Not so much vaccine hesitancy, but when am I going to get my vaccine? I understand that. It's been a long, hard year for all of us to get to this point. And now we have this golden bullet almost within our reach. And now we have vaccinators to give the vaccine, and now we've run short of vaccine. It's a bottleneck in the production. Be patient, keep the faith. We live in the Piedmont District of Virginia. This is probably one of the safest areas in which one could live in the United States. We have the lowest incidence of positivity, despite the fact that we're getting carried along with the sweep across the nation right now. We're still in one of the safest areas in the world to live. And it's because of our people who have complied with every mitigation measure, recommendation, request from the CDC, from the Department of Health, from our partners at Centra. Everybody out on the street is wearing their mask. Everybody's maintaining that social distancing. Washing our hands. I have alligator hands. My hands are so dry. But we've done so well, so long. In 2 or 3 months, we're going to have everybody covered with that first dose. We've got more vaccine coming down the pike. We have new vaccine platforms coming down the pike. It's going to be a couple dark weeks ahead for the whole country. But we, as a district, as a county, can do this. We've already done it. We've already proven these things work. Masking is 83% effective. Vaccine's going to be one more tool that's 95% effective that we can just lay on top of that. We're going to be wearing masks for a long time, folks. It's not going to go away this summer, but we're going to get through this, and we're going to do it by working it together. Thank you very much.
Thank you.
Two things to emphasize as to what Dr. Nash said: faith and patience. The darkest of night is always before the morning's dawn. And we, each of us, need to thank God that we've got a vaccine for this global pandemic. You know, there are countries in this world that don't have the purchasing power, the buying power that the United States of America has, much less the Commonwealth of Virginia. We need to thank God tonight that we've got a vaccine and it's in arm's reach. It might not be at our fingertips, but it's at arm's reach. And it's going to take all of us, again, coming together as a region, all 7 counties. It's going to take all of us, not just Prince Edward, but every last one of us, whether we're a farmer, whether we're a preacher, whether we drive a school bus, teach school, you know, whether we work in the prisons. It's going to take all of us, and we need to appreciate that we live in a place that at least has the vaccine coming to us, because there are many parts of the world that don't. And we need to be patient, we need to have faith, and we need to carry on, and we need to do the right thing and get vaccinated.
Cam, on behalf of the Interfaith Collective and Farmville Cares, I want to thank you for the moderation of this program. It's just run so smoothly, and I'm just so fortunate to have you on this team. Jordan, Julie, Justine, Dr. Nash, Dr. Webb, Doug Stanley, Scott Davis, Tom Angelo, and Tykin. I am indebted to you for pulling this together. And I think what you are doing right here is role modeling for the rest of our community, is that we've all got to become part of the team in some way, shape, or form. So I would be remiss if I didn't, as someone, as I believe Dr. Nash and Doug talked about, the Interfaith Collective will step up. We're going to be contacting the churches in Prince Edward County and sending out an information sheet with how to get in touch with you and get those rosters of those vulnerable people to you. We commit to that. And I will commit to those who are in the other counties. If you have a faith-based organization and you want to email me, you can do that at gnpwatson@gmail.com. I also want to thank our tech support tonight, the staff at Farmville Area Chamber of Commerce and Tyler Pollock and her staff have managed this event so well. And I am indebted to Mary Jo Stockton. If you have watched any of the Southside Remembrance Vigils on that Facebook page, Mary Jo is the driving force with all of the technical work on that. And we've been doing that since the end of May every week. And so I would remind you that the recording of this will be on the Facebook page of both the Farmville Area Chamber of Commerce and also on the Southside Remembrance Vigil. And it will be also on the YouTube channel, if you don't do Facebook, for the Farmville Area Chamber of Commerce. I also want to just talk about the dedication that has come really with meetings behind the scenes and communications back and forth, and the panelists and the participants. Your dedication really, you are heroes in our community. You represent those organizations that are making sure that they're taking care of our participants. And Dr. Webb, you're here from the federal level, and that is so important for people to understand that someone's really looking out for this process and really trying to make it work. So our frontline heroes are important. And what can you do? Well, you can send them note cards to the hospital. You can send cards to the community medical group, anyone that has come into play with the care and the prevention in this process. There's an effort in the community to send food items up for the staff at the hospital. Don't forget your EMS providers and your fire departments, because they're also busy with this. I would be remiss if I didn't talk about municipal employees. Scott and Doug, I know you manage large staffs, and there has never been a time in the history of our lifetime that municipal workers and sanitation workers and those people that we don't necessarily pay attention to in their regular work, they are vital to what is going on. And I want to thank you, and please express that thanks to your staff. And so if you see someone out there, thank them, no matter who they are, for doing their job during such a frightening time. Both of you have been working, I'm sure, with emergency management through the state and the federal government. That's countless hours. I can't imagine that anybody on this panel is working less than 40 hours a week. I would guess it's way more than that. So for those of you listening, become part of the community team. Find some way that we can help expedite this process. And there are ways to do that. Share with your friend and your families the information that you've gotten here. Share with them how to find the scientific information and the accurate information. Also, I think just, again, taking the advice of Jordan, especially when he says, wear your mask, wash your hands, and social distance. That is really important. And we're going to have to do it even after we're vaccinated. Thank you all so much for this.
Patsy, I just want to thank you as the person that helped to bring this together alongside Tykin. So appreciate you all. And, I think we are done for the night.
Okay.
Thank
We'll
you.
see you soon.
Thank you all.
Good night, everybody.